If you're caring for someone with dementia, you face challenges every single day, but some are just gut-wrenching. And maybe the worst one of all is when the person you've built a life with looks you in the eye and accuses you of the worst betrayal imaginable. Yeah, hearing that, it's like a punch to the gut. It's confusing, it's infuriating, and honestly, it can make you feel completely isolated. But here's what you have to hold on to. This accusation, it's not actually about you. It's a symptom, a very specific symptom of the disease. So, here's what we're going to do. We're going to walk through this together. We'll start with that initial shock and figure out why this is even happening. Then we'll get into the stuff that doesn't work, and more importantly, the stuff that does. We'll talk about when to call in the professionals, and we'll end with what might be the most crucial piece of the puzzle, taking care of you. All right, so let's dive in. What is actually going on here? This isn't just some random paranoid thought. No, this has a name. It's a recognized medical condition. It's called Othello Syndrome. Yep, named right after that character from Shakespeare who let jealousy completely destroy him. And just giving it a name, that's a huge first step. It helps you start to pull the disease away from the person you love. And listen, if this is your reality, please know you are not the only one, not by a long shot. Look at these numbers. One study found it in almost 9% of dementia patients. Some research puts that number even higher, closer to 16%. So as painful as this is, it's a tragically common part of this disease. Okay, we need to pause here for a second and talk about something really important: safety. Because in about a third of these cases, these delusions can bubble over into aggression or even violence. I can't stress this enough. Any threat, any physical aggression has got to be taken seriously. Your safety has to be priority number one, period. Okay, so with that safety warning in mind, let's get to the big question. Why? Why is this happening? Because if you can understand the why, it becomes a little bit easier to not take it so personally. Remember, this isn't about your relationship. It's about what's happening inside their brain. It really comes down to two main things. On the one hand, you've got actual physical damage to the brain, specifically in an area that controls reasoning. But on the other hand, there's this huge psychological piece. Imagine how terrifying it must feel to lose your memories, your control, your independence. This delusion can almost be like a weird defense mechanism, a way for a frightened mind to explain a world that doesn't make sense anymore. So, knowing why it's happening helps us figure out how to respond. But before we get to the what to-do list, let's talk about the what not to-do list. Because honestly, our first instincts here, they can really backfire. I mean, your gut reaction is probably to argue, right? To show them proof, to get angry, to defend yourself, and that's totally understandable. But here's the thing. You can't use logic to fight something that isn't based in logic. A delusion is a fixed belief. Arguing with it, well, it's like throwing gasoline on a fire. All it does is make them more upset and dig them deeper into that false belief. So, if our gut reactions are all wrong, what's the right move? It's about making a shift, a big one. Moving away from an emotional reaction and toward a calm, strategic response. The goal isn't to win an argument, it's to de-escalate the situation and find a way to connect. And this new approach really rests on 4 pillars. We've already talked about the first one, safety. That's always step 1. The other 3 are empathize, redirect, and reinforce. So you're going to acknowledge their feelings, gently change the subject, and then shower them with love and reassurance. Okay, this next one is maybe the single most important and trickiest skill to learn. You have to validate the feeling behind the words without agreeing with the words themselves. So look at this example. You're not saying, yes, you're right. You're saying, that must be a terrible thought. See the difference? You're connecting with the fear, the anxiety that's driving the delusion. And when you do that, the argument just stops because you're on their side emotionally, even if you're not agreeing with their reality. All right, so once you've made that emotional connection, your next move is a gentle pivot, a redirection. The goal is to get their mind out of that painful, looping thought and onto something else, something positive and calming. And it's not just any distraction. Like in this example, you're not just saying, hey, look, a bird. You're intentionally steering them toward a happy, shared memory. Pulling out old photos, talking about a favorite trip, you're reminding their brain of your connection and your history together. It's a powerful way to bring them back to a place of security. Now, that's how you handle it in the moment, but you can also play offense. Start being a detective. Are there triggers? Does it happen at a certain time of day or when you're on the phone? Once you spot patterns, you can start to build a more secure environment. Things like a predictable daily routine, filling the house with happy photos, more hugs and hand-holding, all these little things can make a big difference and maybe even make these episodes happen less often. Look, these strategies are incredibly helpful tools to have in your toolbox, but they are not a replacement for professional medical help. We have to remember, this is a medical symptom, and sometimes it needs a medical treatment plan. When you talk to a doctor, they'll almost always start with non-medication approaches, basically the kinds of behavioral strategies we've just been talking about. But if the delusions just won't let up and are causing a ton of distress, medication can be an option. Things like antipsychotics or SSRIs can be really effective, but obviously that's a conversation to have with the doctor, and it has to be monitored very carefully. And this is why it's so important to get that help. Just look at this. It's kind of mind-blowing. Treatment works. It can bring relief in up to 70% of cases. That's a huge number. But then look at the other number. The average family waits 3 years to get help. 3 years. That's 3 years of pain and heartache that might be preventable. If you take one thing away from this whole explainer, let it be this. Don't wait. Please don't wait. Okay, we have spent all this time talking about your loved one. Now let's talk about you. Because you are the most important person in their entire care plan. And taking care of yourself isn't selfish. It's not a luxury. It is a survival strategy. First things first, you have to give yourself permission to feel whatever you're feeling. It is 100% normal and okay to feel hurt, to feel betrayed, to be angry and frustrated. It's even okay to feel like you just dislike them in those moments. You're in an impossible situation. You're grieving a relationship while simultaneously being attacked by the person you're trying to help. So yeah, your feelings are valid. Every single one of them. So what can you actually do to cope? Here are a few things. First, find a mantra, something you can say over and over in your head, like, this is the disease talking, not them. Second, get help for you. You can't do this alone. Find a support group, a therapist, even just a friend who really gets it. Third, you absolutely must take breaks. Get respite care, keep up with a hobby, do something that is just for you. And finally, try to let go of what the relationship used to be. Accepting that your role has changed can take a huge weight off your shoulders. I want to leave you with this thought. I know this is incredibly painful, but please, please remember, this is not an attack on you. It's not a comment on your love or your devotion. It's just the sound of an ailing, frightened brain that's trying its best to make sense of a world that's become confusing and scary. What you're doing matters. Your love is real, and you are not alone in this.